The United States appears to be on the verge of a second vaccine option now, with a key meeting taking place today to talk about drug makers Moderna's vaccine. Meanwhile, Pfizer's vaccine rollout well underway. If you were watching us here on Wednesday, you saw NBC medical contributor Dr. Vin Gupta, along with his colleague, both receiving their first doses live here on the third hour. Dr. Gupta joining us again this morning with an update on how he's doing, along with CNBC's senior health and science reporter Meg Tirrell with the latest on the vaccine front. Good morning to both of you. And Dr. Gupta, let me just start with you. First and foremost, the big question, we're all wondering, how are you feeling today? You look good. Any side effects?
Good morning, Craig. Thanks for having me back. No, I'm still a little sore in my left upper arm where I got that shot from Nurse Allison. But other than that, I feel great. I didn't experience a fever. Low-grade fevers we hear may be common. A headache might be common that resolves quickly. None of those. So I'm feeling great.
Good news. Glad to hear that. As you know, on Wednesday, it was reported, though, that a healthcare worker in Alaska had a bit of a serious allergic reaction to the Pfizer vaccine, needed to be hospitalized even. What do you say to those Americans who will use that as a reason, as justification not to get vaccinated?
Well, Craig, after I got vaccinated yesterday, I actually had a few meetings with patients that get their care at community health centers across the country. And I was hearing the same thing, vaccine hesitancy. And one of the responses there is, this vaccine will save lives. It will keep people out, Americans out of ICUs across the country. That is clear. There are safety concerns on these allergic responses. In the case of this Alaska health worker, it was apparently unexpected. We can manage that. We understand that that's causing some degree of anxiety, but that is manageable, and that's why you're seeing the CDC recommend that any vaccination drive should have medications on hand to deal with allergic responses, whether they might be expected or unexpected. But Craig, to be clear, that is readily treatable, even if if someone doesn't have a history of it and just presents itself during the vaccination process. There's a 15-minute observation period after you get vaccinated. The process works. That's when these reactions were discovered amongst these workers in Alaska. So this process works, but this vaccine saves lives, Craig. No doubt about it. 3,600 Americans lost their lives just yesterday. We are in the midst of an out-of-control pandemic. This is our way out of it.
Really puts things in perspective there. Let's thank you, Dr. Gupta. Let's bring in Meg here. Meg, you've been covering the vaccine development from the beginning. The Moderna vaccine is in the same emergency approval process that Pfizer was in last week. Let's do a real side-by-side comparison. What are the three big differences, if you will, between the two vaccines?
Yeah, so the great news is that on efficacy, they're both at 95% and protecting you from getting sick. So that's wonderful. So there are a few differences. One is in the storage. We've talked about the Pfizer vaccine needing to be kept arctically cold, minus 94 degrees Fahrenheit. And the Moderna vaccine doesn't have to be kept quite as cold. And so that could determine which facilities get these vaccines. Maybe large medical centers getting the Pfizer one, and maybe smaller ones or more rural ones getting the Moderna vaccine. Another difference is just when you'll have to come back for your next shot. Pfizer, it's 3 weeks. Moderna, it's 4 weeks. And then what Dr. Gupta was talking about there with any potential sort of reactogenicity, what you might feel like the day after getting the shot. With Pfizer's, there were reports of headache and fatigue the next day, whereas for Moderna's, you heard slightly higher effects of those, as well as muscle and joint pain. And guys, this has really been compared to the shingles vaccine, where you might feel kind of yucky the next day, but it's much better than getting the disease itself.
Yeah, which is exactly what Dr. Gupta was just talking about. Meg, one more question. I know you sat down with Dr. Fauci yesterday about the most common misconceptions regarding these vaccines. What does he want people to know?
Well, one of the things we hear a lot is, can you get COVID from the COVID vaccine? He says, absolutely not. It is just impossible from the way that these vaccines work. Another question, of course, is these went at warp speed, the fastest vaccine development in history. So does that mean that they're not as proven or as safe? And he said, no, this is based on years of work, and that's how they were able to go so fast, but no stone was left unturned in terms of determining the safety and the efficacy here. And then finally, the question we all want to know, can we stop wearing masks after we get this vaccine? And he said, sadly, no, until we know more about these vaccines and if they prevent transmission, and until enough of us get the shot to stop the transmission completely, we have to wear our masks.
I think we'll be seeing masks for a while. Dr. Gupta, Meg Tirrell, good perspective this morning. Thank you both.
Thank you.
All right.